Okay.
Do you want to start?
Okay. Hello, everyone. Welcome to the Council to Prevent Opioid Dependence. This is Managing Inflammation and Pain Through Diet webinar. This is our second in our Alternatives to Opioids for Pain webinar series. The Council to Prevent Opioid Dependence is a nonprofit organization advocating for the prevention of opioid dependence. And we are educating about the risk of opioids and alternatives available. If you missed our first webinar in the series, Managing Therapy, using massage therapy for pain management, you can view it in the webinar on our website, which is www.ctpod.org under our events section. This webinar is being recorded as well and will be posted to our website after we have concluded. The council is providing information only and is not endorsing or receiving compensation from the presenters. So always check with your doctor first before starting a treatment, different type of treatment option. Tonight, we are excited to host Dr. Sandra Musial from Plant Docs in Providence. Dr. Musial is a physician specializing in nutrition and obesity. She has a Bachelor of Science degree in Nutritional Sciences and a medical degree from the University of Massachusetts Medical School. She's also a culinary coach from Harvard's Chef Coaching Program and has a certificate in plant-based nutrition from E. Cornell and a health coaching certificate from the Institute for Integrative Nutrition. She's board certified in obesity medicine and started an obesity clinic and the first vegetable garden at the Hasbro Children's Hospital. Tonight, she's going to talk to us about how we can use a plant-based approach to chronic pain management. So welcome, Dr. Musial. We're really excited that you're here.
Thank you so much for having me. And welcome, everyone. I am the founder and creator of Plant Docs, and I'm going to be talking about a plant-based approach to chronic pain management. I'm just going to, oops, you kind of just said all this, so we'll skip over that slide. I'm just going to jump into the difference between acute inflammation and chronic versus chronic inflammation. I'm going to talk a little bit about foods that lead to inflammation and foods that relieve inflammation. And I'm going to talk about the gut biome and the importance to inflammation, and then a little bit about Plant Docs and what we do and how we might be able to help. So acute inflammation is kind of the classic kind of inflammation when you have like an acute injury or a bug bite or an infection and you have pain, heat, redness, and swelling at the site. And if it involves a joint, you might have loss of function. Different things, many different things can cause inflammation in your body, but usually it's because there's some kind of substance that your body is recognizing as foreign. So examples are infections like bacteria, viruses can lead to endotoxin production, and the endotoxins can be inflammatory. Autoimmune disorders are when your own antibodies attack healthy tissue and that leads to inflammation. Toxins in our environment, in the foods we eat, in the air we breathe can lead to inflammation. Tissue injury like cuts, bruises, fractures, burns, and then tissue death itself caused by lack of blood flow can lead to inflammation. And there's different conditions in the body that lead to chronic inflammation, which leads to chronic pain. And I've grouped them into chronic diseases of affluence, orthopedic-related, back pain, autoimmune, and stress-related pain. So the first one is, and as I was writing this, I was realizing chronic diseases of the Western world is what we used to call like obesity and diabetes. But these conditions are really spreading all over the world, including even in Africa, where typically obesity rates used to be quite low. So this is kind of an outdated term. And they also used to say diseases of affluence, and where like historically people who had more money would gain more weight and have more of these problems. But there's a term, I used to work in the obesity clinic at Hasbro with children, and I called it malnutrition obesity. We would see all these children that were suffering from obesity and conditions related to obesity, but they were eating the most awful kinds of foods that were really lacking in nutrition. So even though they were obese, they were malnourished. So I think maybe a better term is lifestyle-related chronic diseases. And this means like the obesity epidemic that everyone's well aware of. Obesity leads to type 2 diabetes and insulin resistance. And they're so tightly linked that there's a term called diabesity that C. Everett Koop had coined years ago. And then these both lead to heart disease. So this is all related. Orthopedic injuries like a rotator cuff injury or carpal tunnel syndrome or arthritis can all cause chronic pain and chronic inflammation. Back pain is one of the most common causes of chronic pain, and it can be from a variety of things, including disc problems, spinal stenosis problems, poor posture with just weak truncal muscles leading to chronic back pain, malalignment issues. Autoimmune diseases are very numerous, and this is when your body attacks its own tissue. And some of the more ones that I'll be talking about are like type 1 diabetes, is when your own body attacks some of the pancreas cells that produce insulin, and then the body can't make insulin anymore, or multiple sclerosis, thyroiditis, Graves' disease, Hashimoto's are pretty common in the thyroid gland, rheumatoid arthritis leading to chronic inflammation and pain of the joints, fibromyalgia, peripheral neuropathy. There's so many, but this is a very common cause of chronic pain. And stress is one of the most common causes of headaches and very tightly connected to fibromyalgia and chronic pain. So chronic inflammation is complicated because there's a lot of things that can cause chronic pain and inflammation, but then inflammatory states themselves can lead to chronic pain and chronic diseases. For example, obesity or, having excess weight. People used to think it was just this fat tissue in the body. Excess fat tissue was just inert, meaning like it didn't do anything, but it's actually a metabolically active tissue. And fat cells within that make up the fat in the body produce something called adipokines. And they're these metabolites that act all over the body like hormones and can lead to other diseases and inflammation that lead to other diseases. So it's actually, very complicated inflammation itself. A good place to start, if you wanted to do something to decrease your inflammation, which anyone who has chronic pain and inflammation would want to do, it's, wise to choose something that, has no side effects. So food, it's what I do, of course. So it's, my passion and my interest is this field of food as medicine. But I would urge anyone who has, inflammation and chronic pain to start here, because it is just, there's no downside. So these are some of the most common foods that lead to chronic inflammation. And refined carbohydrates are just pervasive in the American diet. So all this refined flour and refined products. So white bread, white pasta, white breakfast cereals, white pizza dough, and then all these snack foods, chips, crackers, donuts, pastries, are just all made with this refined carbohydrates that are quickly metabolized. And it's basically, similar to just eating sugar. I put these together, French fries, margarine, and oils, like these unhealthy fats. French fries don't count as a vegetable because to me, they're little sponges that just absorb the unhealthy oil. And oils cooked under high heat become even more inflammatory. So these refined oils are very high in omega-6 fatty acids, which are more inflammatory in the body. So corn oil, safflower oil, sunflower oil, soy, vegetable oils, and any products made with these oils. And margarine, they've really kind of tried to eliminate margarine and the trans fats everyone has heard so much that lead to inflammation and heart disease. But it's all been replaced with palm oil, if you've noticed. Palm oil is popping up in every like processed food now and is taking the place of these trans fats, probably just as bad. So I would avoid the palm oils as well as all of these sugary things. Sugar sweetened beverages like iced tea, sweetened coffee, sports drink, soda are just packed with sugar. And this is one of the things we had in the obesity clinic. We poured the sugar into the drink so you could see how much sugar is really in them. It's just like drinking liquid sugar, all of these drinks. Red meat and processed meats are some of the worst inflammatory foods, especially like, hot dogs and these, it has the chemicals in it. And then if you cook them under high heat or on like a grill, like it's even worse, carcinogenic and inflammatory. Dairy products, especially the full fat ones like full fat milk and cheeses are very inflammatory in the body. There's some argument that some fermented dairy products might be less inflammatory. For example, like a yogurt that has active cultures in it, but I still advocate for plant-based yogurts. And alcohol, except for maybe red wine, are all inflammatory and can contribute to chronic pain. So this is a quote that I use in every talk I give, that the food you eat can either be the safest, most powerful form of medicine, or it can be the slowest form of poison. And that's kind of the field of food as medicine. There's a spectrum of food from being some food that's like super healing and medicinal, and like broccoli sprouts, for example, is probably one of the most healing, nutrient dense foods there is, to a grilled, fried, bacon wrapped hot dog. It's probably the slowest form of poison, and everything in between. So instead of, and it's kind of the way our medicine, is, what we're taught in medical school and the way doctors treat disease is with pills. I have this alternative approach that maybe we can attack a lot of these chronic diseases with food as medicine. And it's not a new concept, as Hippocrates said, let food be thy medicine and medicine be thy food, over 2,000 years ago. This is my garden. So a whole food plant-based diet with no SOS, and that stands for sugar, oil, salt, has been studied extensively and has been shown in studies to prevent, improve, or even reverse heart disease, including coronary artery disease, blocked coronary arteries. Type 2 diabetes can be reversed completely. Obesity, lung diseases, including asthma, which a lot of people don't understand can be related to food, and you can definitely improve the amount of meds that people are on with a whole food plant-based diet. Brain diseases, including Alzheimer's, which is really a small vessel disease and a disease of inflammation. Colon, blood, breast, and prostate cancers are very closely linked to diet. A high fiber diet, rich in fruits and vegetables, has been shown to prevent recurrences of many diseases, cancers, kidney disease, high blood pressure, liver diseases, including fatty liver, many autoimmune diseases, depression, and Parkinson's. I mean, this is quite a laundry list of conditions that one kind of way of eating helps. And I think that it's becoming clearer and clearer in the medical literature that, there's some things in diet that are controversial, but there's some things that everyone can agree on, and are becoming clearer and clearer. And we need to eat more fruits, vegetables, whole grains, and beans as a source of protein, and healthy fats, whole foods. So what does this mean? This is kind of like a shortcut to kind of talk about A through F foods, like a grading system. I try to eat from AB foods, and these are all anti-inflammatory. So A+ foods are whole fruits and vegetable, legumes and grains. They have no labels. It's just fresh stuff. A is minimally processed. So for example, a lentil pasta or chickpea pasta, a whole grain bread like Ezekiel, whole grain crackers, nuts, seeds, and avocado. And A- is like white rice or nut milks. Still all, fine. B foods are plant-based processed foods like veggie burgers or vegan cheeses or plant-based ice cream. I argue that some of these are C if one of the first three ingredients are an oil, a sugar, or a refined flour, then I would put it in the C category, because C is oils and sugars, D is animal products, dairy products, eggs, and F is those fried foods, fast foods, French fries, burgers, processed meats. So these are the most inflammatory, the F foods. One quick little app that I love that I use all the time when I'm helping people to transition to eating this way is to just download this free app by Dr. Greger called Daily Dozen. It looks like that checkbox, and it tells you what are the things you should eat every day to get all the nutrients you need if you were to only eat like whole food, plant-based, and try to cut out less animal, have fewer animal products. And I'm just going to go through what that dozen is. So 3 servings of beans a day, and either cooked or like hummus, 1 serving of berries. And he separates berries because they're just so high in antioxidants and nutrients. And this is the start, this berries part is the start of 9 servings of fruits and vegetables a day. So the first is berries, 3 other servings of fruit per day. Cherries and pomegranates are some of the best. Citrus, it's good to have a variety, eat the rainbow. 1 serving of cruciferous vegetables today that include, it's either like broccoli, cauliflower, cabbage, kale, bok choy, super rich in anti-cancer properties too. 2 servings of greens per day, and the darker, leafier ones, the better. This is kale and Swiss chard from my garden. And then 2 servings of other vegetables, either, leafy or in the form of vegetable juice or cook or raw. The more variety, the better. And I like to think of ground flaxseed as a medicine, 1 tablespoon per day. It's an anti-cancer food. It lowers cholesterol, including your LDLs and triglyceride. It's great for type 2 diabetes. It's a very anti-inflammatory food because of the healthy fats that are in it and the ratio of the omega-3 to omega-6. So I have everyone take a tablespoon of this per day. And then there's some, fatty fish pros and cons, because some fishes like sardine, mackerel, salmon are a good source of omega-3 fatty acids. But the cons to eating fish are that it does contain saturated fat and cholesterol if you're trying to lower your LDLs. It has no fiber, which is good for you. And there's a lot of unknown contaminants in fish, and we just don't know what we're getting when we eat fish. So the rest of the daily dozen are 1/4 cup of nuts and seeds per day. Walnuts are some of the best. Spices, the most important one for inflammation would be turmeric, and at least 1/4 teaspoon a day. You can take it in capsule form as long as it has the black pepper added, because black pepper increases the absorption of turmeric 2,000 times. You can buy it in the, probably the best form is this root on the left. It's like a ginger root, and you just grate it up using a little micro grater, and you could put it in your oatmeal. You could put it in a stir fry. You can add it to soups, or you can use the ground turmeric that comes in the bottle. I have like all the different forms. I actually add it to my coffee every morning. And then whole grains, 3 servings per day. And this is in place of all those refined grains. If you were cutting out all that, these kinds of carbs are not bad carbs. These are the healthy carbs that are good for you and reduce inflammation. The only exception might be someone who might have like a gluten sensitivity. Then you might want to stick with the whole grains that are gluten-free. The 11 daily dozen is drinks, lots of fluids, especially like healthy things like hibiscus tea, green tea, and just water. And the 12th one is exercise. It's so important to keep moving, especially with chronic pain, as long as it's not something that's aggravating an injury. And it doesn't have to be 1 hour all at once, which I think has become sounding overwhelming to most people. It's just as good to break it up. So you could do a 15-minute walk, 15 minutes of weights, 15 minutes of gardening, 15 minutes of dancing. And somehow that doesn't seem nearly as bad as doing like an hour on like an elliptical or something painful like that. I like to think of fun things like going for a bike, walking my dogs, doing some yoga, mixing it up. So you have some strengthening and some aerobic. So when we eat, we're not only feeding ourselves and our cells in our body, but also our gut biome. And our gut biome is the bacteria that lives in our gut. There's trillions. There's more gut bacteria in your gut than there are human cells in your body. And the cool thing is that it's ever changing. You can change the kind of bacteria you have and how many you have by what you eat. Why is this important? So if you were to eat a diet of all these inflammatory foods that we talk about, and that was kind of, a lot of people eat that way, it leads to a poor quality gut biome, which we call like bad bacteria. These bacteria feed on and damage the gut's protective mucus layer, and also can increase endotoxin production in the gut, which further like increases the amount of inflammation within the gut. And then the bad bacteria can also lead to negative effects on your metabolism, like less energy, poor sleep, easier weight gain, effects on the brain, like feeling mentally sluggish, poor attention, and effects on the immune system, like decreased ability to fight off disease. When you have good bacteria, a lot of really interesting things happen. You decrease the amount of calories that are absorbed from food and decrease fat storage. So these are kind of positive things for metabolism, especially for someone who's trying to lose weight. Good bacteria helps decrease inflammation and endotoxin production in the gut, increases that protective mucus layer, increases the enzymes in the gut that make you feel full, and boosts your immune system. So, you know, the opposite of bad bacteria. So the next question, how do you improve your gut bacteria? How do I make that shift from bad to good? And it's really just about the quality of the food that you're eating. So this is a gut health food pyramid. Fresh, cooked, and fermented vegetables should be eaten in the biggest quantity, and then fruits. And if you look at the daily dozen, there's 9 servings of fruits and vegetables. So this is, you know, there are a lot of parallels here. Legumes, beans, tofu, tempeh, and then less as you go up this pyramid. So fermented foods are food sources foods that have been fermented and have naturally occurring good bacteria in the food itself. And these are some examples. And Cheek Kitchen is a local Rhode Island company. They make a vegan kimchi, which is a spicy cabbage of Korean like origin. It's very good. You don't have to, you're not going to eat the whole jar, right? You just take a couple pieces and add it to whatever you're having, or just, you know, have a spoonful every now and then. Same with all of these. The Lost Art is another local company, and they make these really delicious sauerkrauts from cabbage and other fermented vegetables. And organic miso is a fermented soybean paste. And you would use that more like, you could have a miso soup, which is probably the most common thing, but in the Plant Docs recipes, we use a lot of miso in like sauces and seasoning. It gives that umami, salty, savory yumminess to food. So just gonna look at the time. All right, so I'm going to tell you a little bit about Plant Docs and what we do. We have different programs. One is called Jumpstart Your Health. and it is our month-long program, which I'm going to go into more, and kind of our most popular and most, kind of profound, I'll show you with the results offering. I also do private one-on-one consultations that are an hour long. And I know people love it because whoever gets to talk to their doctor for an hour, especially just about like diet and health, and get your questions answered about that. I have a monthly Cooking Together with the Plant Docs program. And in 2023, I'm going to do global cuisine. So each month we'll cook from like a different country around the world, all healthy, fun recipes that have no oil, and they're all plant-based, all anti-inflammatory, and it's fun. Everyone starts to get to know one another in the Zoom rooms. I also have group classes for cancer survivors and corporate wellness programs. So I started the Jumpstart Your Health program when Plant City opened in July of 2019, which is our local Providence plant-based food hall and marketplace. And these are my two partners, Dr. Stein and Dr. Lee. And this is in Plant City Cellar, where we run the in-person classes, but there's always the option to do everything remote if someone wants to. And what the Jumpstart Your Health is we created this program, the three of us, that we get labs before and after. And that's kind of the coolest, most unique thing about our program, because we check lipids, which includes like the good and bad cholesterol and triglycerides, glucose, and an A1C, which most people know from television commercials is like the measure of type 2 diabetes or pre-diabetes, how much extra glucose you have in your blood. AST, ALT, which are markers of fatty liver, and a high sensitivity CRP, which is a marker of inflammation. And we do this blood work before and after, blood pressure before and after, BMIs before and after. And during the program, it's 4 90-minute group sessions. 2 are educational and 2 are cooking together, where we make a breakfast, lunch, and dinner. And then it includes a nutrition consultation afterwards. And the idea is, in just 1 month, it's kind of like an experiment or a challenge. Like, why don't you just try? Because most people are like, I don't want to give up this or that, or it sounds too strict. But the idea is just try it for a month, see how you feel, see what a huge impact making this change can have on your health in these labs and your blood pressure and your BMI. And then afterwards, we talk about like, well, maybe you just want to do 80-20, like 80% of the time you're eating healthy and 20% you can do whatever, like whatever works for you. But this was one of our early classes, the smaller class in the very beginning. This is one of our our cooking classes that are remote. We kind of cook, we all cook together and we show you, and everyone cooks in their kitchen while we cook in our kitchen. And our data, people lose about 1 pound a week, which is, it may not sound like much, but as a physician and obesity medicine specialist, this is an ideal rate of weight loss. If you lose too much, like some kind of competition, like The Biggest Loser, it doesn't work. You feel deprived, you have cravings, and it doesn't stay off. This is like, weight loss is not the goal. It's a side effect of eating healthy, and 1 pound a week is perfect. Cholesterol drops in just 1 month, 38 points for people who have a cholesterol greater than 200. And for people who have a bad cholesterol over 100, it drops 22 points. Triglycerides drop an average of 22 for people who have an elevated triglyceride. And fatty liver, which is early liver changes as a result of excess body weight, obesity, or high cholesterol or diabetes, is reversible. And we don't have a lot of numbers on that because most people don't have this, but for people that do have it, we're seeing drops of 23 and 29 points. And then this is the marker of inflammation that we check. And this is a significant value. We've had this analyzed. I'm working with someone from the Brown School of Public Health. And we are seeing in just 1 month a drop in this inflammation marker. And as far as diabetes go, diabetes is a spectrum from insulin resistance to pre-diabetes to type 2 diabetes. And the problem, the underlying problem with diabetes, like why is the insulin not working? Because in type 2 diabetes, you make insulin, it's just not working. And the why is because there's intracellular fat, meaning inside the cell, there's this fat buildup. So when you eat too much fat, and you have too much fat on your body, it's not just the fat that you might see under your skin, but it also gets around the organs and inside the cells. And when it does, it interferes with the function of the insulin receptors, and too much glucose builds up outside of the cell and can't get in. So in our program, we measure for this and we evaluate this. We see people improve or reverse their prediabetes in just that 1 month, and learn that they have it. They didn't even know they had it. We see this all the time, because in prediabetes, you're not really symptomatic. For people who have type 2 diabetes, glucose starts to get under control so quickly that sometimes people need to adjust their medication in the first week or two. And we see A1Cs start to drop, but that takes longer than 1 month to correct. So if you want to learn more about Plant Docs, you can go to my website, which is plantdocspvd for Providence.com. And if you go on the last page of my website and sign up for my newsletter within the next week, because I'm going to lose track, I'll send you 10 of my favorite recipes and a promo code for a free cooking class of the classes that I'm going to offer in 2023. They're normally $20 a class. I would love it if you'd follow and like us on Instagram and Facebook, and our handle is @PlantDocsPVD. And I also have a YouTube channel with some silly cooking videos @PlantDocsPVD as well. Please email me with any questions or anything that you interest to have in any of our programs. And my email is at the bottom, sandy@plantdocspvd.com. Thank you. And I'll take any questions now, I think.
Right. If you have questions, just type them into the Q&A, and we can have Dr. Musial answer your questions. You have a shy crew tonight, I guess.
That's okay. Also, if you don't want to ask them publicly, but you have questions, you can feel free to email me. I love talking about food and food as medicine.
Oh, we have one question. Here we go. Are there any healthy margarines out there?
Nope. Sorry.
Okay.
There are no healthy margarines. And I'm a real advocate of whole healthy fats. So olives, nuts, seeds, avocado. I'm not a fan of any of the oils, even extra virgin olive oil, which a lot of people are like, what? But I think we overdo it. Probably a tiny little bit is okay, but I think we've gotten crazy with the oils, the way it's in like every processed food, and we use it a little too liberally in cooking, I think, as well. And then high heat, it's no good.
Okay, we have another question. I'm allergic to tree nuts, soy, and legumes. Can I still do your program or do this diet?
Yes. Tree nuts, legumes, and what was the third thing?
Tree nuts, soy, and legumes.
Soy. Yeah, it would be more challenging, but we can offer substitutes for everything. I know I love soy, but I get it. People have allergies to things, and we work around that.
What types of things would you substitute instead of tree nuts, soy, and legumes? Like olive oils and avocados, and using them kind of as a base?
Right. I mean, I think flaxseed, chia seeds are good, high fiber and have protein, and would be the source for like omega-3 fatty acids, because you wouldn't be able to get them from the tree nuts. Or you can take like an algae omega-3 supplement as far as for that goes. You can get protein from whole grains and vegetables without the need for the soy and the legumes. That's tough if it's every single legume. I'd be curious to learn more and to know more about the allergy. Does that include like lentils and chickpeas?
Okay. There's another question. Where can you buy turmeric root? And can you get it in the grocery store? And then question, and you put it in your coffee? I actually put it in my coffee, and I find that it helps a lot. I put coffee and black pepper in my coffee. It sounds like it would be awful, but it actually doesn't take away from the taste of the coffee.
The first question, you can get turmeric root in any supermarket. It's usually in the produce section where the ginger and probably like the, fresh herbs would be. I don't get any money from this company, but I love Jamu. It's JAHMU. It's a Rhode Island company that produces this turmeric mix. And it has like all these different spices in it that are all anti-inflammatory, like ginger and cinnamon and cloves, and along with the turmeric. And that's what I put in my coffee every morning, is that Jamu spice.
Great. Next question is, no seafood of any type allowed, totally plant-based. I have Barrett's esophagus and can't eat some of the things you recommend, like turmeric and anything spicy. How can I substitute?
I didn't hear the first part. So they want to substitute for turmeric?
Yeah, well, the first part was, the question was no seafood of any type allowed. And then
no.
totally plant-based question mark. And then it says, I have Barrett's esophagus and can't eat some of the things you recommend, like turmeric and anything spicy.
Yep.
How can you substitute?
Got it. I mean, I eat seafood sometimes. It's not like being vegan. It's more like being knowledgeable about what foods are good for you and healthy, and just making calculated choices. So because I hate being told you can't do this, you can't do that. So if I want a lobster roll, I'm going to go get one. But I wouldn't have it every day. And if I were doing this program, I guess it depends on the condition, the state of my, if I had like coronary artery disease and I'd have a heart attack, yes, I would cut out all seafood 100%. But if you don't have those conditions and you don't have a big family history of heart disease, then, having seafood once in a while, I think is fine. Like in the blue zones of the world, the areas where the greatest number of people live to be over 100, they've studied these areas extensively, and they're primarily whole food plant-based. They do have some meat or some goat, like at a celebration, but they don't eat meat the way we do in America, where we just overdo it. The portions are too big, too much, too frequent. So in the program, the point is to kind of see, if you go 100%, like how much can you change it? So during the program, it works best if you cut out all seafood. You don't have to, you can do whatever you want. But if you really want to see if you're going to drop your LDL, then we say, yeah, cut it all out. As far as the Barrett's go, everybody's individual, and I would avoid, if the spicy foods are not good for you, I would just avoid them completely. And we always work with people for substitutions. I've never heard of turmeric being bad for Barrett's, so I'm just confused about that. Maybe it's the capsule that's aggravating, like maybe in like mixed with oatmeal, it wouldn't be bad. I don't know. I guess I'd want to learn more about that and what symptoms.
There was another question about which plant milk is the most nutritious.
It depends. If you mean protein, it's probably soy. So it depends what you're looking for. If you mean lowest calorie, lowest fat, it's more like almond milk, unsweetened almond milk. So, soy milk has more calories, but is higher in protein. So I guess it depends what you want for nutrition. And then one of my favorites is oat milk, low fat oat milk without oil. Full fat oat milk is oats and oil. You have to read your labels. Wow. So make sure you're finding a nut milk with no oil and no sugar.
Oh, good to know. Do you have particular brands that you favor?
I buy Oatly low-fat oat milk. And then the almond milk, I think I buy just like the Whole Foods brand unsweetened almond milk. Those are my two go-to.
Have you been working with patients who have, chronic pain through inflammation? Yes, because myself, the reason I'm doing part of this series is to share, alternatives for managing your pain, obviously, because I had a car accident a few years ago and I suffer from chronic pain. And looking for, all different types of ways to manage that pain without having to take any type of medication. So, is there anything else that you can share with us about managing pain and things that studies that you've done or people you've worked with that you've seen results with?
I mean, I have seen results during the month with our program. I remember one gentleman that when he started, he was always wringing his hands just because he had chronic pain of his hands, arthritis, wrists. And I noticed like 2 weeks into the class, he wasn't wringing them. And he hadn't even, really noticed because it was just like this pervasive thing. And I said, you don't seem to be wringing your hands anymore. And he's like, you're right. And I hear this all the time that people talk about during the month, their pain starts to get better. They start sleeping better. They feel more energy. I mean, all of those things are related to decreased inflammation. I think you see, more profound effects over longer periods of time of staying on a really healthy anti-inflammatory diet and avoiding those really pro-inflammatory foods. Because I do think that the shift in the gut bacteria has a lot to do with it, but that it takes like a good year to like really shift over your whole, gut bacteria, getting rid of the bad ones and more of the good ones. That takes time.
Mm-hmm. Well, this has been extremely informative and looking forward to maybe even working with you to help, manage my own chronic pain. So I hope everyone else enjoyed the webinar tonight. We have another one coming up in January, and we'll be sending out some information on that webinar that will be focusing on how meditation can help manage pain. And we'll be talking to Swami Jay, who is a local expert in meditation. And that should be up on our website as well on www.ctpod.org. So thank you very much, and thank everyone for attending, and have a great night.